When it comes to health, many of us know we should get regular checkups, yearly physicals, dental exams, maybe even that skin mole we keep meaning to get checked out. But how often do we think about our eyes? For women in particular, eye health is an area that's too often overlooked. Maybe you notice some minor changes in your vision and chalk it up to spending too much time staring at a computer. Or you figure watery eyes are just part of allergy season. But the truth is, there are several eye problems that women are more prone to, and many of these issues can be surprisingly easy to ignore until they're not. Let's start with dry eyes. If you spend all day working at a screen, you probably know what dry eyes feel like. That gritty, burning sensation, maybe a feeling like there's sand stuck under your eyelids. What you might not know is that women, especially after age 40, are actually twice as likely as men to suffer from chronic dry eye. Hormones play a huge role here. Fluctuations during pregnancy, menopause, or from using birth control can all affect tear production. Add to that time in air-conditioned offices, wearing contact lenses, and heavy eye makeup, and you've got a recipe for dryness that a couple of eye drops at lunch, one tea always solve. If left untreated, chronic dry eye can lead to inflammation, infections, or even damage to the surface of your eye. So if you find yourself constantly reaching for artificial tears, it's not something to ignore. Another common issue, changes in vision tied to hormonal shifts. It's not unusual for women to notice blurry vision during pregnancy or menopause, or even for things to seem off during certain points in their monthly cycle. Hormones can actually change the shape of the cornea, temporarily altering how we see. Most of the time, these changes are minor, but if you notice that your vision gets noticeably worse and doesn't return to normal after a couple of days, it could be the sign of something more serious, like gestational diabetes or high blood pressure. Both of those conditions, left unchecked, can have lasting effects not just on eye health, but on overall health. Now let's talk about makeup. Many of us use eyeliner, mascara, and even eyelash serums without a second thought. But eye makeup can be a sneaky culprit for eye issues, especially blepharitis, inflammation of the eyelid margins. If you've ever woken up with red, swollen eyelids, or a stubborn sty, makeup residue might be to blame. Old eye makeup, and yes, we all guilty of holding on to mascara for a little longer than we should, can also harbor bacteria, making infections more likely. It's important to remove eye makeup carefully every night and replace products regularly. If you notice itching, excessive redness, or persistent swelling, it's worth getting checked out. Then there's the risk of cataracts and macular degeneration. You might think these are problems that only show up in older adults, but here's the reality. Women are at greater risk for both conditions, especially as they age. Cataracts are the clouding of the eye's lens, leading to blurry vision and glare. Macular degeneration affects the central part of the retina, causing loss of sharp, central vision. Family history, smoking, and sun exposure all increase risk. But women live longer on average, so the overall odds stack up higher. This makes regular eye exams after age 40 or 50 even more important. Many women also brush off persistent headaches or eye strain. These can be signs of uncorrected vision problems, like astigmatism or presbyopia, the age-related decline in near vision. Ironically, women are more prone than men to undiagnosed refractive errors, partly because so many just deal with it, or assume tired eyes are no big deal. If you're getting headaches at the end of a workday, find yourself squinting, or notice you're holding your phone farther and farther away, it's time to book an eye test. Autoimmune diseases like lupus and rheumatoid arthritis, which disproportionately affect women, can also cause silent eye problems. Dryness, inflammation, even vision loss can track along with these conditions. If you've been diagnosed with an autoimmune disease, don't forget that your eyes need special attention, too. The bottom line is this: it's incredibly easy to overlook eye issues, especially when life is busy or symptoms are mild. But just like you wouldn't ignore chest pain or a toothache, changes in your eyes shouldn't be brushed aside. An annual comprehensive eye exam, ISNT, just for people who wear glasses, it's a key step in protecting your overall health. So the next time you reach for your mascara, your contact lens case, or your favorite blue light glasses, remember, your eyes do a lot for you. It's time to return the favor and give your eye health the attention it deserves.